as you kind of start to evolve and start to educate yourself and start to heal from being on birth control for a really long time, things are going to, having that foundational education is really important. And I think that it really takes around 6 to 8 months to see those results.
Welcome back to the Holistic Hormones Podcast with me, Dr. Ami Patel, pharmacist and hormone consultant. I've transformed my pain, struggle, and journey with managing my PCOS into my passion to support women to gain freedom from their hormone imbalance symptoms. On this podcast, I share practical tips that have worked for me and my clients, as well as conversations from experts in their field. Welcome back to the Holistic Hormones Podcast and YouTube channel. Today, we have the honor of having a guest speaker talking to us all about fertility and acupuncture, and I'm really excited about the conversation ahead. So Dr. Hoehn, thank you for taking the time out to be here.
Thank you so much for the opportunity to talk to your listeners. I'm super excited so far about our time together.
Yeah, me too. Me too. We've been having a lot of great conversations. So a little bit about Dr. Hoehn. She is a Los Angeles-based fertility specialist. She's board certified acupuncturist and herbalist and supports family building either through natural conception or supporting IVF. Dr. Hoehn's credentials include a master's from Emperor's College of Oriental Medicine and a doctorate from Pacific College of Health Sciences. She has an underlying commitment and skill in her field. Beyond her practice, she also educates future acupuncturists as a lecturer and contributes her expertise to the Oova Medical Board. And she serves as a medical advisor on the board, helping influence the direction of fertility acupuncture. She is a respected fellow of the American Board of Oriental Reproductive Medicine and a member of the Pacific Coast Reproductive Society. She's dedicated to advancing reproductive health. And for thoughtful expert care for fertility in the Los Angeles area, be sure to reach out to her.
Yeah, that's a lot to say and so much now. And now the podcast is done. I'm just kidding.
No, I mean, it's really amazing to see, your passion and how much experience you have in fertility and acupuncture. And that actually leads me to my first question, what did get you into this space and what is the why behind what you do?
Yeah. Well, thanks for asking. I actually started in the film business and I had an accident at work. I was in the camera department and and so I had a pretty life-altering accident, and acupuncture was the only thing that got me back on my feet. And I was so amazed that at the same time I used to also have painful periods, and I used to every day of my first day of my period I would throw up, take some Advil, and go to work. And it was like, I didn't even know that there was another intervention out there. And at the same time, my acupuncturist, who's now my amazing mentor, got me back on my feet again so that I could go back to work. He also healed my painful periods. So it was just amazing 1-2 punch. I don't know if that was intentional. We hadn't really talked about it, but I realized at that time that the medicine was so powerful that I needed to give more people access to that medicine. And so I started studying it, and I just started with general acupuncture at the time. And then because I was a female camera assistant, which was kind of a minority in the industry at the time, I then started seeing a ton of other female camera people. And they had very similar things. So I was like, why do more people not have access to this amazing, powerful medicine? And so then I started studying it a little bit more, and then fell into the TCC space because I recognized a lot of gaps in education and interventions in terms of choice when it came to reproductive health. So that's why I started studying my doctorate and started really looking into the research a little bit more around the TCC, trying to conceive space and family building.
I love that. And it's crazy that the accident just changed the whole path of your life and future and career.
Yeah. Yeah.
And Oh, go ahead.
I was just gonna say, it's really funny. I heard this once, is that your mess really becomes your magic, right? And your passion. And
I
it's really funny. I've had like 3 careers so far, and it's just really interesting how one kind of moves into the other.
Yeah, and you know, one thing that really stuck out to me that you said that you didn't know if that like you didn't originally go for addressing the periods. And what I
Yeah.
really like about like Western medicine, I feel like really focuses on like one thing. Like this is a problem, that's all we're focusing on. But I feel like what Eastern medicine, like, you know, acupuncture, Ayurveda, a lot of other medicines focus on you as a whole. So yeah, you went there for that one thing, but this is your irregular periods are also impacting you in a way as well. And so the way that medicine works is that it addresses the person as a whole.
For sure. And one other thing about that too is that I think my ignorance around that what is normal in terms of a menstrual cycle. I bet you can talk about this a lot, but that I was told, I'm 50. So it like I was told as a child that like this is what it was going to be like and this is how it was, right? My mom had the same thing. Nobody ever talked about it. My mom just went to work. And so that's how I grew up, is just to kind of just go to work and take some Advil and just tomorrow's a new day. And I think that I love now that we have all this awareness and people like you that really show people that the menstrual cycle is a fifth vital sign. It's not normal, and to please dig deeper and ask questions.
Yes, thank you for that. But yes, it exactly. I think, you know, that could be a whole podcast on its own. But yes, to summarize that, I agree that we as women we're not told what is normal, and we're just expected to put a smile on our face and just go on about our day, no matter what we're struggling with, whether it's periods or something else. But, you know, with what you're doing to support women as well, like we're here to change that. And so I'm so glad that we've collaborated and are having this conversation. Because
Yeah,
even
for
with
sure.
things like infertility, right, and like miscarriages, people are just expected to like, I just feel so awful. Like when people have miscarriages, I know like sometimes insurances or other treatments aren't covered unless like you have 3 miscarriages or some like ridiculous, you know, numbers like that. And there's just not enough support out there for that. So really appreciate what you're doing with that. And
Yeah.
that
And this
brings,
is more about, like, so sorry about this, but like this is more about the policymakers need to be more women and not
oh,
a man that does not practice
definitely.
medicine. But again, speaking of whole other podcasts, like when okay, just
Yes.
stay to the nuts and
We can
bolts.
do that. Yeah, we'll have to record some more about where we go off on boxes.
For sure.
But that brings me to the next question. So, what role does acupuncture play in supporting someone who is trying to conceive? And also, does it also help men? Like, can men use acupuncture for their fertility? Because I know we talk a lot about periods and women's fertility, but yeah, I love your thoughts on both.
Yeah, so we know for a fact that acupuncture can regulate blood flow to the reproductive organs. So that can go for both men and female. And basically, I think I talked about this on the Instagram live, but we know that acupuncture along certain points, specifically for the female, can open up the femoral artery and get more blood flow to the uterus and the ovaries. So that's very important for either IVF frameworks while trying to conceive, or even natural conception, just because getting the best blood flow and oxygen exchange to the reproductive organs is really important for implantation and then also follicular development. It can also help with the HPOA axis. So that is an axis, as you know, the hypothalamic pituitary ovarian adrenal axis, and help regulating any imbalances that can be happening with that communication. And then we talked about this in detail as well, is that regulating cortisol response and regulating that nervous system is penultimate to the best TCC kind of pre-health care that we talk about. Because cortisol has a really unique and profound interplay on inflammatory response. And if there's any inflammatory involvement in your menstrual cycle or um, your TCC journey, we want to make sure that we're removing those inflammatory products at the front line, as opposed to trying to unpack that later on in your journey.
Yeah, that's a good point. And this can also be for men too, right? Like their stress or
Yeah.
the,
Yeah,
um,
so there's a lot of new data around when we think about sperm parameters, we're thinking about motility count and morphology, right? So motility, how the sperm swims, morphology, the shape of the sperm itself, and count is the amount of sperm in one amount of concentration, right? So using these techniques of acupuncture and herbal medicine can help improve morphology specifically. That is also more in the world also of whole systems medicine and nutrition. But yeah, and also working on inflammation and antioxidants. And oxidative stress is really important as well when we think about sperm parameters. So those are all things that can help when you get your partner on board.
wow, that's so amazing that it's beneficial for both. And I feel like recently, I don't know if it's just me or I guess maybe really recently conversation is changing around fertility in terms of looking at males' role in infertility as well. I feel like before it was a lot about like infertility means that something is wrong with the woman, but I feel like now more is coming about also making sure the man partner is also at optimal health. Is that my understanding? Or, I mean, is that what you see in practice as well?
For sure. You know, male factor is about 43% of all infertility cases, right? So that's a huge, enormous number to just say to somebody, yeah, you've taken this basic, very not nuanced workup at all, and you're fine, right? I don't know if we want to be making fine babies or really healthy, excellent babies, but the other thing that's really interesting is the World Health Organization takes the diagnostic criteria for sperm parameters and lowers them, evaluates them, and lowers them within each time period. And so the sperm parameters of now and present day would not even be deemed fertile 10 years ago. That's a big deal. So we're actually just lowering the bar overall and just having men just kind of walk over it, and also giving them a clear bill of health. I mean, I don't know. I think it's human nature to just say, if this doctor in a white coat ran this lab, then I believe that my sperm is not the issue, right? It's fair. I mean, I would say the same thing if I didn't know what I knew, right? Like you and I live in it all the time. So it's just different for us. But really thinking beyond sperm parameters is really how we want to start approaching fertility, so that it can be a partnership and a collaboration, as opposed to you do you, you're on this side of the line, then I'll be over here because my lab levels are fine. So what are we talking about here? It's a little different.
Understanding your menstrual cycle is key to optimizing your fertility. Society and cultural beliefs have made us think that periods are an inconvenience and make us women weak. In my free upcoming masterclass, I want to help you become empowered about your menstrual cycle so you can use it as your superpower. Learn about the benefits, different phases, what periods and birth control really are, how to improve your fertility and alleviate PMS symptoms. You have two options to join, either Tuesday, April 30th at 6 p.m. EST or Friday, May 3rd at 12 p.m. EST. Check out the link in the description to save your seat. Join live for a free bonus, but if you can't join live, then sign up to receive the replay. That's definitely a good point you brought up. And yeah, I didn't know the exact statistics, so that's really interesting to know, 43%.
Yeah.
Another question I have is, what are the some common myths you have to clear up with your patients around being on birth control and if it's hard to conceive after coming off of birth control. Because I know like birth control is a hot topic now and even more so now. But yeah, if you could share.
Yeah. So, again, this is kind of like I would kick this one back to you because this is more your, as a pharmacist, more your clinical expertise. But just in terms of clinic and my workups and like what I do is I generally tell people to give themselves the space and time for around 6 to 8 months when you're trying to conceive to kind of work on your hormones and balancing them naturally, and really starting to hone in and learn about, educate yourself about your cycle, right? Because as your cycle regulates, you have to have some way to track your outcome measure and see, okay, when did you ovulate? What was cervical fluid doing? All of these different patient milestones that are really important to the TCC journey that you need to start folding into the batter of your health, so to speak. So, as you kind of start to evolve and start to educate yourself and start to heal from being on birth control for a really long time, things are gonna having that foundational education is really important. And I think that it really takes around 6 to 8 months to see those results. Um, and we spoke about this on our live too, is there's a lot of demonization around OCPs, but thinking about it in a different lens where it's just being responsible around knowing and recognizing what those side effects are and being really informed before you decide to use birth control, right? I think that that is something that's kind of overlooked a lot.
I agree. Yeah, knowing what it means, the role it plays for you, if it aligns with like your long-term goals, knowing that, if it is only for symptom management, that's fine if that's what you want, but knowing that, eventually when you do come off, if you don't make lifestyle changes, some of those symptoms may still be there. But I do like that you pointed out that you support women and men that also may be going through IVF. And so I think there has been this like battle, like only Western medicine or non-Western medicine, but there's a way that you can integrate both where you can get the benefits that you're looking for. So I do like that you not only support women that want to conceive naturally or families that want to conceive naturally, but are also going through IVF as well.
I do too. I love it. And I'm really indoctrinated into IVF in terms of support as well. I have an amazing reproductive endocrinologist that I refer to almost exclusively. That's great. And we have a great partnership. And I really love that he recognizes that role of having this person on a team. And we actually see great results. Like this first quarter for me at my office is the highest amount of pregnancies of all time in 8 years that I've been in clinic. And also, we have great patient feedback from people that do acupuncture and herbs and really set up themselves for success going into a retrieval. And their recovery times are so much profoundly better. The results are so much better when they're on, we usually say a treatment cadence of once a week leading up to your retrieval or your transfer, and then twice a week once you get your first period and you're going through a retrieval cycle, twice a week leading up to your transfer. So, just that kind of notion of acupuncture dose and how it supports IVF, both sides of IVF, has just been so incredible. And people are recovering better; they're having better live birth rates. I mean, it's just such a great complement to an IVF intervention.
Yeah, that's so amazing. And I love how you said like you've partnered with
Yeah.
a provider. I think, when it comes to managing our healthcare, we have to remember that there's a lot of people that can support you with that, and it's a lot of teamwork between healthcare professionals too. So
Yeah,
yeah,
and it's our responsibility as clinicians to also communicate, right? It's like I think like both sides of the coin, like the IVF side of the coin, and then my office our hardest thing is being having time and communicating, right? And that's every clinical office is like managing a patient base is just like it takes a huge enormous team. So making sure that that's part of our responsibility in terms of standard of care is really important when you're looking at a fertility acupuncturist.
Definitely. Yeah. So speaking of, what are some things like specifically someone can look for if they do want to get support from an acupuncturist? Like, how do they know that like this specific acupuncturist is the right fit for them and their goals?
Yeah, I love that question so much. It's like you read that off a Google form. Just kidding. um, yeah, so I really think that it's really interesting as an acupuncturist in America. You get a master's degree, and you have a massive amount of clinical hours you have to do, right? And so most of us emerge from acupuncture college with this master's degree and a general understanding of what acupuncture is in terms of all of the different kind of disciplines within TCM or traditional Chinese medicine, right? So I think it's really important to find somebody. If you are going to for fertility support, go to a fertility acupuncturist. I turn away people all the time that ask me about knee pain. I say, unless you want a baby to come out of that knee, I am not your girl. Or I also have an amazing person that I went to school with that if you have psoriasis, then you're going to Dr. Black, like you are not coming to me. Um, so I just really just have tunnel vision in terms of my care. And I think it's really important when you interview your fertility acupuncturist, and you should interview them to make sure that they're ABORM certified. And that's extra training and certification in terms of reproductive health as it relates to TCM frameworks. And then also that they're an herbalist, right? I think it is definitely the left hand of acupuncture, which is the right hand. And you really want somebody that knows how those two things work synergistically together to get you the results that you need.
Yeah, that's a good point. So I guess my next question is with, I guess it might be obvious, but I'm just going to ask it anyway. So if somebody, I know when people are trying to conceive, there's like lots of medications and things that are like, you can't take this because it's not healthy for the baby. So these herbs, are okay for people to use when they're on the journey to conceive, or, after they conceive? Are they okay?
Yeah, absolutely. So basically what happens is in terms of trying to conceive and regulating your hormones, you're going to do a different set of herbal formulas and acupuncture at the beginning of your cycle. And then in the luteal phase, you'll do a second set of herbs, right? And it just depends on who your provider is and if you are comfortable taking herbs throughout your pregnancy. For me, what I do is I switch to a lot of functional medicine and supplementation that way because I know specifically the support that um, I just feel more comfortable in that world. So I just kind of use whatever is in my toolbox based on where you are in your pregnancy journey.
Okay, that makes sense. So it is very personalized as well, and the individual has a say in how much they want to like do the herbs or not do the herbs, or et cetera, et cetera.
Yeah, for sure.
Awesome. Another question I have is, what are your holistic changes and recommendations that someone and their partner can make to prepare for conception? I think like earlier, we touched on like teamwork, reaching out for support and resources, and you had mentioned like understanding your cycle. But I think like nowadays, like we were talking about in the live, like growing up, we didn't know what our cycle meant, what's normal, what's not normal, but now there's a lot of resources out there. So are there any resources you have as well that you can touch on?
Yeah. We have a program that's called the Make a Baby Bundle, right? And so basically it's two parts of the, I guess, Oreo cookie, if you were to say that. So we have one part of the mini course is sperm success strategy, and the other one is called Chi Quality Eggs. And this is all about both programs are geared towards foundational changes that you can make that are very easy to implement, and you can do them both at your own pace. There's about 8 modules, and I kind of always work foundationally from pillars of health, meaning removing chemicals from your home. Obviously, mindset and meditation come into play. Sleep as a whole entire, almost like a Swiss Army knife of medicine. And nutritional changes and interventions, things to avoid, things to start incorporating in terms of supplementation, And then some self-care that you can do at home, obviously. If you are not in an area where you can have a fertility acupuncturist on your care team, then this is a great framework to just set you up for success right away. And it's a very easy thing to implement, right? So it's just going to be open. The cart opens next week. So if you want to join our early interest page, you can do so in the link in bio as well at the Instagram, Dr. Beck Hoehn.
Awesome. If you could, so this episode will go out during National Infertility Awareness Week. So if you could just say what date it is that the cart opens.
Yes. Yes. Good call. Sorry, Dr. Patel.
No,
Yeah. So cart opens on the 21st. So this is really exciting when this podcast airs, actually. So that'll be really exciting. And we'll send you a link for your show notes so that your listeners can enjoy first dibs on the course.
Yeah, that sounds great. And yeah, I'm glad that we're able to time this with the National Infertility Awareness Week. And thank you so much for what you're doing to support families on their journey to overcome infertility and fulfill their dreams of having babies.
I'm excited. I'm also excited to meet you. And I'm so excited that there's more of you in the world.
Yeah, we can, connect in person, play some pickleball and all of that.
Pickleball, totally.
So you did mention your handle. Is that the best way to connect with you if people want to reach out to you, want to learn more about you and your in-person services as well as online programs?
Yeah, for sure. If you want to connect with us, the office name is Mighty River Wellness, and that's in LA. And then also you can always DM me in the Instagram, and we're on TikTok, all the things at Dr. Beck Hoehn. And if you want any questions around the Positive Pregnancy Project, which is our comprehensive course that starts in June, which I'm really excited about. The Make a Baby Bundle is more of a warm-up course. So the Positive Pregnancy Project is really guided. It's very high touch. I'm there with you every step of the way during your TCC journey. So, but yeah, connect with us on Instagram and we'll talk to you soon.
Yeah, that sounds awesome. Lots of great resources that, from an expert who has experience supporting people, who's seen the struggles that people go through, the best things to help them. And I think now, I feel like a lot of people or women in general maybe want to do things themselves a lot, don't like to reach out for support, but these resources are out there now and it can just help expedite your journey. You can do things on your own, but it just may take longer. You'll go through a lot of trial and error. So it's okay to reach out for support. We have great resources and experts out there. So yeah, reach out to Dr. Hoehn. You can also reach out to me if you have any questions about hormones and
Pickleball.
Pickleball. Yeah, so reach out to us and I will link all of Dr. Hoehn's links and handles in the show notes.
Thank you, Dr. Patel, and all the best with Heal. We love
If you enjoyed this episode or learned something new, please share it with someone who can also benefit from it. I'd love to connect with you. Send me a DM on Instagram at holistic.hormones.pharmacist.
As always, be kind